Incisional hernia. To understand this problem, one has to know what is a hernia. Hernia is a defect in the abdominal wall through which the normal contents, which is basically the intestines, they start protruding out. So this, in my earlier session, I have told you this can be compared to a cycle tire in a tube, wherein if the tire gets weak, the tube can bulge through that. So where all can the bulge happen? Wherever there is a weakness. The weakness can be natural in certain areas like the belly button or in the groin, or it can be man-made, like when somebody undergoes a surgery for some problem, maybe for cesarean or for uterus operation or for any other reason. The scar is a weak point, and when over a period of time, when the scar becomes thinned out, intestines start bulging through that, and that is called as an incisional hernia, a hernia which happens in the previous incision or a scar. So what are the symptoms and complications of this problem? The symptom of an incisional hernia is a bulge. The patient starts feeling that whenever he or she strains, they get up from a chair, they lift a weight, or they climb a flight of stairs, they find that from the previous scar area there is something bulging out, and gradually this bulge keeps increasing in size. As more and more intestines start protruding out, the defect becomes bigger and bigger, and that starts creating more problems. In some patients, whatever intestine has come out through the defect can get twisted or can get blocked inside the hernia, and that can cause sudden pain and vomiting, and this becomes a sort of an emergency. So how do we diagnose incisional hernia? Majority of hernias can be easily diagnosed by a clinical examination. So when your doctor examines you, he'll be able to find out a defect in your previous scar and be able to make out whether a hernia is present or not. In certain patients, because of extreme obesity or because of multiple surgeries, there might be a difficulty in diagnosing this, and then a CT scan can tell exactly where is the hernial defect, and also if there are any new hernias which are in the process of getting formed. How are these incisional hernias treated? Okay. Do we have to treat incisional hernias? Can we treat them with medicines? All incisional hernias need treatment, and they cannot be treated with medicines, because basically it is a hole through which intestines have come out, and they need some sort of a surgical intervention to close the hole and also to make sure the new holes don't form. Medical treatment is not useful in the treatment of any hernia. What are the surgical options available for treatment of incisional hernia? Traditionally, these hernias were treated by means of another operation where over the scar another cut is made, the hernia is again pushed back into the abdomen, the hole is sutured, and then a mesh is placed so that these hernias don't recur. But of late, there is an increasing popularity of laparoscopic repair for these hernias, whereby we avoid making another cut on the abdomen, and the entire repair is made with the help of keyhole surgeries, through which the hernia is again reduced back. A special type of mesh called a dual mesh is introduced into the abdomen, and wherein a special type of mesh called a composite mesh is introduced into the abdomen, and the hernial defect is patched so that the hernia does not happen again. What is the advantage of this laparoscopic repair? Just like any other laparoscopic procedure, the pain involved in a laparoscopic hernia repair is much less compared to an open operation. Return to work is much faster. The chance of wound infection, chance of having a drain pipe is all minimized in a laparoscopic repair, and the chance of recurrence also is lesser when compared to an open operation. Laparoscopic hernia repair is the most preferred way of treating majority of incisional hernias, and the success rates are very encouraging.